Understanding the illness. 2.1. What causes bipolar disorder? Research has shown the presence of bipolar disorder indicates an imbalance in brain chemicals called neurotransmitters. Although the direct cause of the illness is unclear, it is known that genetic, biochemical, and environmental factors each play a role. Body chemistry can bring on a depressive or manic episode due to the presence of another illness. Altered health habits, stress, substance abuse, or hormonal changes. In addition, studies have shown that the illness often runs in families, and that stressful life experiences can trigger some symptoms. Nonetheless, like schizophrenia, genetics may explain causation in a large number, but not all cases. There may be multiple neurological pathways that lead to developing bipolar disorders. Where bipolar disorder comes from: genetics, biology, and stress. Bipolar disorder is understood as a genetically determined disorder of the brain that results in an alteration in one's thoughts, feelings, and behaviors that are not readily controlled by an individual's will or desire to control them. According to the American Academy of Child and Adolescent Psychiatry, identical twin studies have demonstrated that if one twin has bipolar disorder, there is a 70% chance that the other twin will develop it as well. There is a 4 to 6 times increased risk of a child developing bipolar disorder if that child has a parent or sibling with bipolar disorder. Even though a child may be at 4 to 6 times increased risk of developing the disorder when their parent or sibling has bipolar when compared to the general population, most children whose parents or siblings have bipolar disorder will not develop bipolar disorder. Proper nutrition, exercise, an adequate amount of sleep, avoiding overly stressful life situations, the absence of trauma, and avoiding substances that can be toxic to the brain, such as drugs of abuse and alcohol, may possibly prevent or help delay the onset or minimize the impact of bipolar disorder in some genetically vulnerable people. It is difficult to argue against the idea that people are responsible and accountable for their behavior. Professionals, patients, and families rightfully worry about the relationship between stress and bipolar symptoms. There are numerous assumptions and hypotheses relating stress and illness onset, severity, and cycling. The research supporting any of these concepts is scanty. Stress does not appear to be a major factor in explaining why people develop bipolar disorders, nor does it relate to the number of episodes and relapses that are experienced. There is some evidence that the first depressive or manic episode may be more influenced by stress than those that follow. Nonetheless, there is little empirical support that multiple episodes are triggered by a kindling process within the brain. Kindling refers to a dynamic interaction where the brain learns from repeated episodes to trigger future episodes automatically. This is believed to happen in seizures, but has not been documented in manic or depressive episodes. As in most physical illnesses, stress is most likely an addictive interacting factor that plays a secondary role in symptom severity and quality of life issues. Stress is created by perceptions, emotional responses, and internal cognitive messages or interpretations. One's perceptions are shaped not only by observations, but also by past experiences, memories, and beliefs. Bipolar illness has the ability to alter which environmental cues are influential, which memories are stimulated by events, and beliefs about observed environmental actions. Therefore, patients' perceptions of the environment vary greatly, are difficult to predict, and often are different from perceptions of others. That is, the stress experienced by a person may be more associated with and shaped by his or her bipolar illness than by current or past environmental events. Furthermore, interpreting family problems as an explanation for increased symptoms is more difficult than it appears. There is no doubt that all interpersonal relationships can be stressful, and that symptoms often increase as family arguments and problems escalate. Nevertheless, family, peer, and work relationships may have become problematic and stressed as a result of increasingly severe and unpredictable symptoms, rather than the patient's symptoms having been triggered or increased by negative environmental factors. Environments are important in the treatment of a bipolar disorder, but offer little understanding of the origins of the illness. Furthermore, assessing the contribution made by environmental settings to a person's level of severity of the illness is difficult. The nature of bipolar disorder is to alter how patients perceive and experience their surroundings. There is no question that many factors outside a person's biology interact with and influence symptoms. Nevertheless, resilience against the onset of a bipolar disorder and potential for remission are subordinate to a person's neurobiological health. The brain's physical ability to respond to medication and accept environmental support is the major factor in determining prognosis. Changes in the brain associated with bipolar disorder alter how the world is perceived, understood, and experienced. Therefore, gaining a goodness of fit between people with bipolar illness and environmental settings is difficult.